Hi everyone, my name is Evelyn Munayco, and this is our project about developing an automated application for analyzing conjunctival photography to enhance the diagnosis of trachoma in children. Trachoma is an ocular infectious disease that is so prevalent in a lot of countries in the world. So, trachoma is an eye infection caused by bacteria, Chlamydia trachomatis, and is the leading infectious causing of blindness worldwide. So the prevalence of trachoma in Peru was 32% in 2019, and the last prevalence record was 58% in 2024. The Peruvian Ministry of Health has not developed any national trachoma elimination strategy, and physicians not be familiar with trachoma. It is important to know about the prevalence of trachoma because WHO mentioned that there is a necessary strategy for elimination of trachoma when the prevalence is more than 5%. Also, there are most costs associated with trachoma screening are related to field work, whether it be training new teams or personal transportation. So also, reliability of clinical examination is poor and disagreement between grades is common. So it's necessary to improve the diagnosis of trachoma in these rural and remote settings. We developed a project in 2023 about training non-specialized field workers to detect vision problems with a smartphone in children. Was possible. Also, was possible have good quality conjunctival photograph with good coverage, focus, no distortion, because it's necessary to have good photographs to diagnose. For example, this is a healthy conjunctiva, and this is a conjunctiva with TF, the Trachoma inflammation follicular. There's a folliculars in the central conjunctiva. The main objective of the study is we aim to develop an automated diagnosis tool using smartphone capture images and deep learning algorithms to assist ophthalmologist field workers in diagnosis of trachoma. And this is a method. The data set include field collected conjunctival images classified from a previous study in Peru. The data set was come from the observational cross-sectional study to determine the purpose of trachoma in 2020. We include 5 districts of the Alto Amazonas province in the Loreto region. This is a part of the jungle of Peru. We include 78 children aged 1 to 9 years. And the average of the age was 5 years, and the majority were female. Only 9% of the household report having access to drinking water, 11 had access to sanitation facilities, and 22% practice adequate hygiene. So this is the data set preparation for our model. We have 3 models, the first one, the second one, and the third one. The first one, we use 20 photographs, the second one, 99 photographs, and the third one, 199 photographs. And when we evaluate that photograph, we noticed that the first model was not accuracy, the second model would have a good accuracy, and the third model have a less accuracy than the second one. And understand about that, what is the AI used for the diagnosis of each photograph. We developed these images with integrated guidance salience map, and we noticed that when the color was red, yellow, or orange, is good for detection of trachoma. Then we have to the dataset preparation. We did not possible evaluate it of the model with a huge volume of photograph. We need a short photograph, and then we have exclusion criteria because it's necessary to have all the conjunctiva to have a good diagnosis. This is the model development for image classification. We developed the model classification in Vertex AI. Just answer this question: is the conjunctival infected TF or not? And we develop all that step because it's necessary to develop data step in the Vertex AI, set up your environment, create a data set in Vertex AI, choose training method. There are 2 methods: AutoML training, custom training. We use AutoML training because it's free. If you had to use custom training, it's a little expensive. So then train, evaluate, and deploy the model. This is the AutoML model workflow, and this is the Vertex AI workflow that I try to explain. Then the first is create or choose a Google Cloud project. The name requires APIs because when you use Vertex AI in Google, it's necessary to use the Google feature, like prepare a cloud storage bucket to host your image data, assign appropriate roles, then prepare your data set because it's necessary to prepare outside the Google and then inside the Google. It's necessary, in my case, I use CSV because when you just upload your images, for some reason the Google changed the position of the photograph. So try to avoid this. I use CSV. It's necessary to use CSV format outside the Google and then upload this format to evaluate them, to have the model, and then create a data set in Vertex AI. When you upload or your data set, the 80% is for training, 10% is for validation, and 10% is for tests. And this is the result of our model. This is the average precision. The precision on recall the performance of the model is good. Then when we have the external validation with 200 photographs, because I want to know about what is the performance of the model outside with other type of photographs. The prevalence was 27%. It is the root curve for TF detection. We have that the area under the curve is 0.92. This is reflecting excellent overall model performance. This is a precision recall curve. The precision shows a strong model performance for detecting TF. This is the confusion matrix heat map. This is show that the model correctly identify 48 to 54 TF positive images. And this is the TF detection model performance matrix with accuracy, sensitivity, specificity, and F1 score. Then our next step is to develop the application, use Firebase because it's necessary to use Google. Then develop the app on Android. The conclusion of the study that is possible integration of the model into a user-friendly Android application could enable rapid offline diagnosis in the field by non-specialist personnel. And this approach could significantly improve trachoma surveillance capacity and support WHO trachoma elimination targets. Our next step is compare our model with other published model about the diagnosis of trachoma, the external validation, because it's necessary to test the model in the real-world testing. The validation in different field settings, like in African countries where trachoma is also prevalent, determine the feasibility and acceptability of the application for the field workers, longitudinal studies. Thank you so much.